Yeah, you can read. There is a lockdown there, so when you
Okay,
reach the bottom, tell me.
right. So is my time started? Three
Yeah, yeah, yeah,
minutes.
yeah, I will start it now. Yeah,
Okay.
yeah.
Can you scroll down, please,
Yeah, sure.
Salim? Uh, Scroll down, please. Right. If you can just stay here. So
Yeah, sure.
can you scroll down, please?
Yeah, sure.
Scroll down, please. Uh, Scroll up, please. Just want to check
Yeah,
the
yeah, sure,
sodium.
sure. Yeah.
I missed. So sodium is okay. 5 human. Scroll down, please.
Yeah, this is the last.
Okay. Right. Can you go back to the medication, please?
Yeah.
Yeah, just stay. Just keep it
Don't,
here
don't,
for me,
don't worry.
please.
Yeah, yeah.
Yeah, I'm ready to start.
Yeah, let me just double check if the recording is working. Yeah, the recording is working. Take a deep breath and yeah, you can start. Yeah,
Yes,
yeah,
start. Hello, good evening. This is Dr. Murtaza from the surgery. Am I speaking with Jack Brown?
yeah, doctor. Thank you for calling.
Is it okay to call you Jack?
Yeah, sure, doctor.
Uh, I was just looking at your record, and it shows that this consultation has been booked for medication review. Is that correct?
Yeah, doctor. Yeah, and to be honest, I was surprised. Usually, they will send me a letter that continue on your medication and everything fine, but then they told me that you need to speak with me. I hope everything is fine, doctor.
Okay, right. We will talk about it. And I can see that you were a bit surprised. You mentioned that uh, uh, you were kind of not expecting this appointment. Correct me if I'm wrong.
Yeah, yeah, to be honest, because usually they will just send me a message that everything is fine and you need to continue
Hmm.
on the same medication.
Hmm.
And the rest they will send either to the diabetic nurse or the
Hmm.
COPD nurse, but they will never
Hmm.
tell me to speak to the doctor. And to be honest,
Hmm.
and the diabetic nurse, I'm doing my best, and I think my numbers are fine now, is improving. Maybe the
Mm-hmm.
COPD nurse, yeah, I missed a couple of appointment. I know that, I have, yeah, but I can't concentrate in both, to be honest, at the same time. So I said, let me fix the diabetes first, and then I will check,
Mm-hmm.
I will see what is happening to my lung. Yeah.
And is there any reason that you miss the COPD nurse appointments?
No, nothing, doctor, because I'm overwhelmed. So I'm just trying to concentrate in losing weight and making my sugar first good.
Mm-hmm.
And then
Mm-hmm.
I will check what I can do for the COPD because I think my COPD is fine. I'm not feeling any problem. It's just the diabetes that I was worried, because of what I read
Mm-hmm.
about all this complication of the diabetes. So I said, let me just control it because it's really was very bad. But I think now maybe I'm better now. I lost weight.
Yeah, yeah, I can see that on your record as well. It shows that your height and weight ratio, which is the BMI, that was 35 2 years ago, and now it's 30. So I think you are already doing an excellent job.
Yeah, thank you, doctor.
And your diabetes test, which is HbA1c, that is also improving.
Okay, so yeah, that's good then. So I think I'm maybe in the right track. So I hope then
Yeah.
there is nothing else.
Well, I mean, I need to discuss, some of your blood tests, and especially your hemoglobin, which is basically a substance in blood. If that's if there is an abnormality in that, we need to, talk about that. And there is something called as hematocrit, which is your uh, red cells concentration in blood, that we need to discuss today. But uh, I just want to discuss with you about your medication. Do you take your medication as prescribed?
Yeah, yeah, yeah. Everything I'm taking it as prescribed, doctor.
Any issues, any side effects with these medication?
No, not at all, doctor. All of the
No.
medication are fine. Yeah.
Good. So I can see there are two blood pressure tablets and two tablets for diabetes, and you
No,
mentioned no issues around that.
no, nothing. And my inhalers as well. I'm taking them, and everything is fine. Yeah.
Okay, that's good. Now, as I mentioned earlier, Jack, your hemoglobin that is raised.
Okay.
Now, whenever hemoglobin is low, we call it anemia, but in your case, it is above the recommended limit. And also, there is something called as hematocrit, which is basically your red cells concentration. Both of them are on the higher side.
Okay. Okay.
Now, Now, that can happen in people with COPD, but I just want to double check and ask you a few specific questions in order not to miss any other condition. Uh, just a few specific questions. In terms of your COPD, uh, how how are your symptoms like? Is it well controlled? And since you missed your review with the nurse as well, like have you got any trouble with breathing? Any
No, to be honest, doctor, since they give me I was in normal trembo, and then they give me the trembo exhaler, and that make the
Mm-hmm,
things easier. So
mm-hmm,
my breathing is always fine. Even now,
mm-hmm,
I was snoring, to
mm-hmm,
be honest, from before.
mm-hmm,
But now when I lost weight, the snoring
mm-hmm,
gone. So
mm-hmm.
yeah, and my sleeping is fine. My breathing is fine. I feel completely okay.
And you mentioned snoring. How long have you been snoring?
Well, I think like 6 months or so, but then the nurses told me most probably you are snoring because of my extra weight. So that's why I was eager to control the weight, and the snoring, improve now. Yeah, there is no snoring now.
There is no snoring. And what about your breathing at night? Do you struggle with breathing when you are asleep?
No, 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 everything is fine, doctor.
What about daytime? Do you think that you are sleepy at daytime?
No, no.
No. And has anybody told you that, your appearance has changed, like any red flushing on the face?
No, 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 no.
Nothing like that. Any itching on the body?
Itching? No, no, I don't have any itching, doctor.
No itching, right? Any lumps and bumps in the body?
No, no.
Smoking history is very important. Do you smoke?
Yeah, to be honest, yeah, doctor, I think you will tell me off for that. Yeah, I still
Mhm.
smoking. I know I should stop, but I will try. Yeah, I will
And
try, but I'm keeping it at the last thing that to do. Yeah.
how much you are smoking, Jack,
Yeah,
and
I'm
for how
smoking,
long?
yeah, 20 cigarettes since ever, to be honest, doctor, since I was, I think, 13 or something.
Okay. And what about alcohol?
Well, occasionally, doctors.
Right. Now, Jake, based on what we discussed today, I mean, really, you are doing a very good job that you have, reduced your weight. But I'm just wondering about, why you are having this raised HB and hematocrit. There are few possibilities going through my mind. Now,
Mhm,
your COPD is well controlled. I thought that that could be one possibility. But the one thing which is standing out in your history is because you are smoking. Now, sometimes even people who smoke, that can raise the HB and hematocrit. So
mhm,
that could be one thing contributing to your raised hemoglobin.
mhm,
And the other thing I was wondering, because you mentioned that you were snoring as well for a
mhm,
while, which has no resolved, and I'm wondering whether whether that has led to raised hemoglobin, because when people snore, they struggle with breathing as well.
mhm.
Uh, and I was meant to ask you earlier, Jack, when you were snoring before, did it affect your breathing during sleep?
No, no,
It didn't. Okay, right. Now, I'm wondering about the options, but before I just jump into the option, is there anything so far you wanted to ask me?
no, to be honest, no.
Mm-hmm. Mm-hmm.
Yeah,
Okay.
yeah, I'm
Now,
listening, doctor. Yeah.
when the HB and hematocrit is raised, we call it polycythemia in medical term.
Okay.
And it could be due to various causes, but in your case, I'm just thinking it, one possibility is smoking and the second possibility is COPD.
Okay. Yeah.
Now how we are going to address it? I'm just wondering, like, is there any possibility if I send you really useful link for smoking cessation clinic, do you think you will be willing to make a self referral to them and they will help you in cutting down smoking?
Yeah, doctor. Yeah. Well, I'm happy to do that.
Yeah, so good. And what about if I book you for the COPD review with the nurse? Would you be willing to come for an appointment just to
Yeah,
review your COPD?
will do, doctor. Sure, without doubt.
Okay, good. And what about your vaccination for COPD? Have you had your pneumococcal influenza
Yeah, yeah, I
vaccination?
had them and had them because they are the same with the diabetes as well. So yeah, yeah, I
Mhm.
have them. Yeah.
Okay, good, good. Now, I mean, again, I'm not saying that that's the case, but in the worst case scenario, sometimes, in cancers, and I
Okay.
mean, in your story, I didn't find that you were losing weight or any lumps and bumps in body, but sometimes, these things can be raised due to serious conditions as well. And I'm just
Okay.
wondering if I sent an advice and guidance to the blood team as well, that my impression is likely it could be due to smoking or COPD, but just to be thorough, how about, getting an advice and guidance from the blood specialist team just to see what they would think?
Okay, doctor. Yeah, no problem. If you would like that, that's fine. But Yeah, it's okay. Yeah,
And shall we repeat your blood counts again, let's say in a month time, to see how is the trend, whether they are getting worse or improving?
yeah, sure. Yeah, why not? Yeah, I thank you being thorough, doctor. Yeah, let's repeat it, doctor. Yeah.
And I mean, while we are waiting for the reply from the specialist team, and I'm seeing you again in a month time. If you develop any symptoms like any pains in your legs, any chest pains or racing of heart, then you need to let us know.
Sure, doctor. Yeah,
Then
I'm
thank
happy.
you. Bye.
Yeah, good. Yeah, good. Yeah. How do you feel?
Hmm, feel a bit rubbish.
No,
Uh,
why rubbish? No, I'm happy. Well, no, why rubbish? It's very challenging case. No, why rubbish? In the beginning, you was hesitating. Yeah, that's normal because from where should you start? Uh,
yeah.
yeah, but then when you start to gather your thought at the end, you did man, you did most of the things that I would do, to be honest. Okay, so you did well. No, you don't need to feel rubbish. I think you did well, to be honest. But tell me what you would do uh,
Mm,
different if you repeated the
mm,
case.
mm. So I mean, like, what I will do differently
Mhm.
for like polycythemia. Uh, I think I mean too much on my mind, but yeah, what are the causes? I mean, I didn't prepare any battle plan before entering into this station, and the reason was I was just trying to read the whole data
Yeah, this is yeah,
appropriately,
but
rather than preparing any battle plan,
no,
not to
but
miss.
expect that you might find a case that 3 pages or
Mm.
4 pages worth
Yeah,
of
yeah, I
reading.
know.
Okay,
That, yes.
yeah,
So that's expected.
yeah,
So I mean, when I was trying to like ask you questions, and I thought I don't think so that I'm dealing with cancer. And the reason is like when I look at the RBC, so it's fairly in the normal range. So
mhm,
the only abnormality was hemoglobin was raised, hematocrit was raised,
mhm,
platelets were normal, and rest
yeah.
of the bloods, I didn't find any abnormality. I don't know whether I have missed anything, but
No, no, no,
I
that's
thought
right.
so. The
You didn't miss
only
everything is because if there's another abnormality, it will be very annoying case. But so go ahead, yeah,
Yeah, so I thought that it could be, secondary polycythemia due to COPD,
yeah.
but from your story, things were well controlled.
Mhm.
And then smoking came in. You mentioned snoring, so I thought whether this is obstructive sleep apnea causing polycythemia. So,
Well, but
mm,
but the three things that you mentioned are connected, isn't it? Smoking
yeah.
connected to COPD, and COPD is connected to obstructive sleep apnea. You have always something called overlap syndrome, which obstructive
Mm,
sleep apnea type, or can sometimes you put asthma with them. So three of them can be overlap. So obviously, they are connected. It might be a case of persistent hypoxia because of all of these. Okay,
mm,
and that's why
mm,
he have the polycythemia can be okay.
mm,
And you did mention that you think of that, and this one of the possible differential, and you mentioned some the other differential, which was, very good from you. So I don't think that you did rubbish at all, to be honest. It's just advice and guidance. Yeah, fine, but if there is causes of secondary hypercalcemia there, you'll just
mhm,
repeat the blood test again after a month,
mhm,
okay, to
mm,
try to
mm,
control the possible
mm,
causes. The
mm,
trick in this case
mm,
scenario, uh,
mm,
high hematocrit in
mm,
COPD
mm,
patient can be one of the
mm,
indication of secondary care referral to assess the
mm,
possibility of the need of long-term oxygen therapy for that patient, even if he's not that symptomatic. Okay, still he might
mm,
be getting hypoxic at night, and he doesn't know. So, however, the
mm,
COPD nurse will deal with it, but this is
mm,
something I would like to hear. And the
mhm,
other thing is how to read
mm,
the full blood count, okay? Especially
mm,
if there is high hemoglobin and high
mm,
hematocrit. Does it
mm,
really matter or doesn't matter? So I
mhm,
personally, when I find something like that, I
mm,
will look at the other at the other cells. So
mm,
white blood cells, red blood cells, platelet. If these
mm,
all are high, so this
mm.
means that this patient
Cancer.
may be having myelodysplastic syndrome. Okay, that then I
Mm,
will refer that, I will refer to hematology
mm,
urgently.
mm, mm,
Keeping in mind, I will do at the same time ferritin. I will do, urgent ferritin, and I will see how the ferritin is, because
mm,
if you have
mhm,
myelodysplastic syndrome,
mm,
this means that the bone marrow is working rapidly and more
mhm,
than it should be, and that will consume all the iron stores and the ferritin. The other thing, if well, I find that it's only the RBCs that is high and the hemoglobin and hematocrit, that will give me two choices. Well, is that, hemoconcentration and the patient dehydrated and
mhm,
giving these symptoms, or this is, a true polycythemia, primary polycythemia rubra. And
mhm,
to differentiate that, I think that will
mhm,
be, for your for day-to-day practice. Okay, it's
mhm,
difficult maybe to be shown in the RCGP exam. If you
mhm,
there is a rule of three. So
mhm,
if you multiply the RBCs by three, the hemoglobin should be there. Okay, and then if you multiply the hemoglobin by three, the
mhm,
hematocrit should be there. So if you now multiply the RBCs by three, you
mhm,
will find that this will be 15, isn't it? Because it's 5,000, 5 by 3 is 15, but the hemoglobin is 190, okay? So it's not 150. So this means that there is a type of hemoconcentration. So most probably this patient is dehydrated rather than
mhm,
that there's true polycythemia rubra. But if the RBCs are high and then you multiply it by three and then give the same, more or less the same number of the hemoglobin, and then you
mhm,
multiply the hemoglobin by three, it will be more or less the same of hematocrit. Okay, which
mhm,
in this case, the hemoglobin by three, it will be like 570. So the
mhm,
hematocrit is much more than, than the expected number. So these may be more towards the dehydration concentration or a bit of secondary hypoxia rather than true
mhm,
polycythemia. So this case is not true polycythemia, not absolute polycythemia. And that's why when you ask about the itching, he said, "Oh,
mhm,
I don't have itching." But
mhm,
even secondary polycythemia doesn't mean that the patient doesn't need assessment and addressing, because it's still
mhm,
the patient will have the risk of having thromboembolic disease,
mhm,
having neurological problem, which is the only thing that I take it against your consultation, that
mhm,
you ask about the causes, but then you didn't ask about the symptoms of polycythemia. So,
mhm,
well, yeah, which is if you have hypernatremia, you need to ask about the symptoms of hypernatremia and the cause of hypernatremia.
mhm,
Hypercalcemia, the cause of hypercalcemia and the symptoms of hypercalcemia, because the management
mhm,
plan are based on the symptoms as well. So, if this patient have
mhm,
symptoms, I will refer him urgently. He have symptoms, blurred vision, headache,
mhm, mhm,
having itching. So, there is a risk of
mhm,
having thromboembolic disease, then I will
mhm,
need to hematology to urgently act on him and
mhm,
give us a decision, which usually they might provide him with all, aspirin or venesection, or ask him to go for blood donation. It depends on
mhm,
what they will consider. Okay.
mhm,
And then addressing the causes, which is, most probably is the COPD and the hypoxia and the smoking in that case, because, you already exclude from his symptoms any cancer. Okay. So this is how I would
mhm,
approach this case. So yeah, you did fine. You said smoking cessation, said COPD. Advice and guidance, I would say, okay, because you are asymptomatic, I would just hold off the advice and guidance. Perhaps I will advise to ask him about how he's drinking enough water or not. I would tell him, please drink enough water. We'll repeat the blood test in 4 weeks time. Okay, and we'll do ferritin and the other, and other, folic acid and B12, just to make sure that we are more thorough. And then we give him the red flags that he should, seek urgent medical advice, which is, as you said, pain in the leg, okay, headache, blurred vision, or to exclude any thromboembolic disease or even chest pain. And that's how I'll approach the case. Okay. But I
Yeah.
think you did a great job. Okay, don't be harsh on yourself because polycythemia is, polycythemia is always a difficult case. Okay. Yeah,
Yeah, yeah, thank you.
yeah.
Exam
Uh,
is near.
Yeah, exam is near. That's why your cases are difficult. Okay, okay. You will never feel perfect except after you've passed the exam, and even after you pass the exam,
Yes. Yeah.
you need to be humbled. Okay, and learn every day. I
Yes.
think your plan was safe, and it's just I meant to bring difficult cases today.
Yeah,
Especially
yeah,
in the
thank
full blood count, because the full blood count is one of the commonest, commonest blood tests that we are seeing, and possibility of having full blood count in the exam will be always there. I will
Yes,
just
yes.
have a look if I missed something from the polycythemia. So this is the absolute and upper. Also, there is algorithm for the polycythemia, how to approach it. Let me just to go through it. And this is the management. Repeat, full blood count, pulse oximeter. And here, this is how to approach it. So look at the other blood cells, if it's normal or not. If it's high, possibility of cancer or polycythemia, do ferritin. Okay, if the other is normal, so you can consider the lifestyle modification and secondary causes. And then the urgency of the referral, don't take it from here because it's not that good. The urgency of the referral, I put it in the other, yeah, in this slide. So if the patient have persistently or extremely high hematocrit, you would refer him, okay, especially in the absence of hypoxia. But if you have, and even if you have also persistently raised, so in the follow up, if you his full blood count in the HR, hematocrit is still high, or he have symptoms of polycythemia, that's why the symptoms are important, because if he have symptoms, you would refer him urgently. If doesn't have symptoms, you may delay the things just for the follow up and try to do lifestyle modification. And this case per se, because he is a COPD, you will ask the respiratory nurse to consider referring him for long-term oxygen therapy. Okay, because you can see polycythemia is one of the indication of probability of long-term therapy of oxygen, and in these cases they will do ABG for him and see if he's the hypoxic hypoventilated type of COPD or not, and then they will proceed with the further testing, and they may consider sleep study as well and see if you have sleep apnea or not. So this would be considered by the respiratory consultant and the respiratory nurse, referring him to the sleep clinic, because they can they can do for him sleep studies as well. Okay, to see his oxygen while he's sleeping. Okay, so the
Thank you.
mentioning that you need to refer him will be unaccounted. Okay, and this is the rule of three. Okay, which I explained. I hope it's clear. Is it?
Yes, yes.
Yeah,
Yeah, thank you.
yeah, no problem. Let me just close the recording and